Hi everyone. Hi nursing student. This is Professor Taylor. I'm the creator of Nurse Tutor Me. I started teaching over 5 years ago, and I teach students both in the classroom and in the clinical setting. I'm here to help you be successful in nursing school and to be successful on all your exams. I created Nurse Tutor Me because I see there's a gap in nursing students not getting the knowledge and not knowing and getting or understanding the must know. And I'm getting students in a clinical setting who come to me and not knowing those must know of certain disease process. What I do is break it down for students. I develop the knowledge boost to highlight the must-know information. You have to know this information before you go and take the state board. There's no way around it. All right, remember the state board test safety. You need to understand the nursing process and how to utilize that in taking your exams. A lot of students, it's not that you're not studying, guys. I'm speaking to you. You are studying. However, you're not answering what the question is asking you. A lot of questions talk about priority. You cannot go and intervene or do an action unless you assess the patient. It is what it is. So go back to ADPI. A for assessment, D for nursing diagnosis, your P is your goal for your patient. Your I, you're going to intervene, and then you evaluate. You cannot skip. You have to assess first before you intervene. And think priority. I always tell my student, when you think your priority, think to yourself, what's going to kill the patient first? What's going to be best for the patient? It's always like that. There's no way you're going to go and treat a pain when the patient have a saturation of 88. All right? And I always tell my student, I've never seen pain to kill anyone, but breathing, airway, or if the patient is bleeding, or if they have a shortness of breath due to a pulmonary emboli, that's what's going to harm your patient. So what I do is break down the must know. It's okay to know that, we're going to treat our patient pain. However, we'll get to it. He's not the priority right now. And I help students get the priority. What do you do first? What's priority? So I break it down for students, and it's a passion of mine to make sure you get it, because at the end of the day, I really want for you to be successful. All right. So check out my website. Go to nursetutorme.com. There's information there and resources. You could book an appointment for tutoring. I have students come on ground to my office for tutor. I have students who tutor online with me. They're 1 hour session. And a lot of times, say today you get your teacher cover the cardiovascular system in class and you don't get it, go on, book with me, send me an email, a message. And what I do with students, they have that moment like, oh my goodness, now I get it. And my goal is to make sure you get it. All right, you have a good day and talk to you later.